School-based health centers is something that school districts all across the country have, and there's actually a national association of school-based health centers. In Delaware, we've had school-based health centers in our public high schools as far back as 1985. What school-based health centers are a really interesting collaboration between school districts and medical and behavioral health care providers to be able to provide medical and behavioral health services and prevention and nutrition services to students who are members. And these services are provided on site at the school. There's no copay for the parents, so there's no money that exchanges hands between the families and the providers. And it allows students to have access to services that they otherwise would have to travel to get. So going to a private provider in the community, missing school, that kind of thing. In Delaware, as I mentioned, we've had them in our high schools since 1985. In the last 5 years, we've started to have some school districts who have created elementary school-based wellness centers. So right now, Colonial School District, Newcastle County, Red Clay School District in Newcastle County, and now Christina School District are actually going to have school-based health centers in their elementary schools. School-based health centers have always been important. They were originally created in Delaware as a way to address problems with infant mortality. Delaware, as far back as the mid-'80s, had a higher than the national average percentage of infant mortality. So school-based wellness centers were introduced as a way to address that in many ways, not the least of which was making reproductive health services available to students in high school. As times have changed, and certainly in the post kind of response to COVID, the idea of families and students being able to access high quality behavioral health services and some basic medical services at school is increasingly important. There's an understanding, there's been a lot of work in the last couple of years around the idea of something called social determinants of health. And among the social determinants of health are not only students' engagement in school and academic success, but also general well-being. And so the research suggests that social determinants of health are highly predictive of outcomes as an adult, connected to employment, mental health status, general health, and well-being. So school-based health centers are a real great opportunity and really a lever for the community to address social determinants of health in our school-age population. So historically, it's been high school. Now we're moving to elementary. Hopefully, we'll be getting some middle school soon. And again, it really represents this partnership across different groups. So the health providers, for the most part, being private, the public schools obviously being public. And we also interface with a number of government agencies, the Department of Education and the Department of Public Health. So starting in spring 2020, policymakers at the Division of Public Health contacted a number of leaders in the community and asked them to be part of a strategic planning process for school-based health centers in the state of Delaware. And this is a process that we just completed in the past week or two. And it's been a little bit more than a year-long process. I would say maybe something like a 16-month process, where we have essentially school-based health centers have been around for a long time in Delaware, but it's been a long time since folks have actually gotten together and looked at all of the major aspects that are required for school-based health centers to be successful, existing centers, and then also to look at what would be needed if school districts were interested in adding new centers. So among the things that have changed over the years is really the third-party reimbursement system by which school-based health centers get paid. So typically, school-based health centers get some money from the state or from a school district, and then they make up the difference between that money and their operating costs by billing third-party insurance. And as everyone I think knows, insurance has gotten a lot more complicated in the last number of years. So we really needed to look at ways that we could collaborate with insurance providers, private and insurance and Medicaid, to try to advocate for a system that would allow these existing centers to be able to stay open and to thrive. And so part of what the strategic plan was looking at is really all the operational aspects of a school-based wellness center, from the revenue side to data collection to kind of a basic menu of services that everybody can be clear that we're doing the same thing, to the idea of maintaining rigorous quality in terms of always doing things that are research-based, and then some of the kind of finer technical details about back office type things. But this strategic plan is put together, I mean, with all said and done, we have a steering committee of just over 20 people. And then we had work groups that probably totaled close to 100 people from all disciplines across the state, from insurance companies to private medical providers to public schools, to people in a variety of state agencies, to consumers. And it was really an interest in really getting as much information we could about how we're currently operating, where we'd like to go with this and how to get there, also with an eye to talking to school-based health organizations across the state at the national level and in other states to try to get an understanding of how they have addressed this. And it's really been a great public-private partnership to bring this together to get to where we are right now. And we've also worked in close collaboration with our legislators as well, state legislators and senators, and been liaised with the governor's office as well in this work. So the strategic plan was developed essentially in two phases. The first phase was there was a core series of work groups that were established in the fall. Each of those work groups had a chair and a work group members, and they met weekly. It was an intense period, and when they met weekly over the fall, over the course of about 3 months, and looked at core issues within each of those major buckets. And during those work groups, we not only had the people that were on the work group, but we would also have ad hoc members, content area experts come in to talk about a particular topic. And over the course of those 3 months, then each work group developed a set of recommendations and essentially worked through recommendations that were as specific as possible. And then in December, we had a convening where the work groups came together, and as a full body, the steering committee, again, which was composed about 20 some members, the steering committee came to agreement on a final set of recommendations that were established as recommended by each of those work groups in the fall. And that was kind of part one. And then part two started in January, and from January through really the middle of June, the work shifted from this development of recommendations to development of an implementation guidelines. And part of the implementation guidelines, really we're talking about, again, how do we make this work? So we know what the recommendations are. How do we get these out to the parties who need to know what they are? And then how do we interface again with the essentially all the parties that we need to have on board in order to be successful? So school districts, medical providers, legislation, the healthcare industry, and third-party reimbursement, insurance companies, and things like that. And then really the development of an interim governance structure to actually implement the implementation plan, because part of what the plan is calling for is not just support from the state and the Division of Public Health, but actually the creation of an interim governance structure that would provide support going forward. So. Well, there's two major ways that the school-based health center strategic plan will implement will help families and children in Delaware. And as I mentioned previously, we really have kind of two categories of groups that we're working with. The one group are existing school-based wellness centers, which have been around for quite some time. In order for these centers to remain viable, there needs to be improvements in the reimbursement system and in the integration of their services into the school system. So part of it is helping those existing centers remain viable. And this strategic plan is got significant elements that are designed to support that existing group of wellness centers, some of which, as I said, have been around since 1985. The other component is to really expand the reach of wellness centers into other areas, so elementary schools, possibly middle schools. So what this would mean for families and children is that right now the school-based health center model in Delaware is 95% high school. So if you're a school-age child, you're a family who has children in public schools, your first opportunity for a child to access this service would be in ninth grade. We'd really like that. We recognize that some of these supports that our children need start significantly before ninth grade. We also want to use this project as a way to help families navigate essentially the healthcare system in our state, because there's a component to the school-based health centers that's not just providing direct service, but it's also linking families to their primary care providers in the community. The school-based health centers are not meant to be a primary care provider. That's not the model. We have some students who have primary care providers, so that the school-based health centers essentially can be a stopgap in between an emergent need versus a chronic condition that the primary care provider would be supporting. We also have some students that are not connected with a primary care provider, in which case the school-based health centers are explicitly designed to connect those families with a primary care provider in the community. So especially with our younger students, which is why we're excited to be able to bring this service into the elementary sphere, we are looking to hopefully increase those percentage of children in the state that have access to routine primary care in the community. The best way for people to get involved in this is if you are a parent of a school-age child, or if you yourself are a student, or you're a community member or a board member or an employee of a public school in the state of Delaware, is to talk to your school district, talk to your school board about what the Wellness Center does in your community, and the fact that that you support this effort and that you recognize that children having access to behavioral health and medical services in the school setting is a benefit to them, and a helpful bridge to essentially, put our kids in the best position to be successful as young adults when they exit the system. And at this point, that's really the best thing that you can do, is talk to your school board, talk to the principal at your school. Do we have a wellness center? And if they say no, the question might be, well, why not? What could we do? We understand that there's opportunities now that the state is putting out money for new elementary wellness centers. Talk to your school administrators about why not put an application in for some of that money to bring this service to our children. There's been significant research, really probably going back in the past at least 20 years, that indicates that exclusionary practices for discipline are counterproductive, meaning that to the degree to which school districts exclude students for conduct issues or violations of the code of conduct, such as fighting disruptive behavior, substance use, ultimately does not necessarily result in improved outcomes for those students. So one of the things that we are certainly doing in my district, in Colonial School District, and others are as well, is that when we have students at William Penn who are experiencing significant conduct issues, part of what we're doing is making sure that they're connected with the Wellness Center. so that it's not just, again, a matter of the traditional, what people think about as being punished, but really being connected with support services. And we do really feel like it's part of our responsibility in the school system to provide our students with access to support, if it's mental health counseling that they need, if it's other types of medical things, even something as simple as a sports physical, which doesn't apply to the discipline, but some of the other medical things that our students might be experiencing, or behavioral health, that could actually be a support for them that would reduce the likelihood of them, continuing in this cycle of, again, either disruptive behavior, substance use, those kind of things, and hopefully keep them part of the school community so that they're in a position to earn credits, proceed towards graduation, earn their diploma, and be able to go out into the world with a strong public education and a diploma that will allow them to do what they'd like to do as young adults.